Hi folks, Paddy here from Compass Physio. This week our blog is about tennis elbow. Most of you may have heard of tennis elbow. It's quite a common condition that we do see in our clinics. And I just want to chat about firstly how it comes on, how it presents. So normally obviously it is lateral elbow pain. So it comes up along the outside of the elbow. There's a little bony prominence there. Pain tends to maybe start around that area and can radiate down the forearm, down towards the middle of the arm and towards the hand. How does that happen? It can be two mediums. Normally it's acute onset, so it's maybe after you've done something, potentially playing tennis, potentially an activity, physical activity, maybe using a screwdriver, or doing repeated action, which involves gripping. The other thing is a gradual slow onset, so it might be how you sit in work, typing. It might be that you do a repeated action in your workplace or repeated action at home, opening a lot of jars, something as simple as that, and these symptoms start to come on gradually. It can start as a little bit of a nip, and then over time it starts to become more and more prominent. So, who's more likely to get it? People over 30, people who play racket sports, or people who've had that sudden increase in inactivity. And what can we do for tennis elbow? These are the key things that we need to think about. Well, here at Compass Physio, the most important thing is to do a detailed assessment to diagnose exactly the problem and that it is in fact tennis elbow. Because there are a couple of other things it can masquerade as. It could be referred symptoms from the neck, it can be referred pain from maybe back of the shoulder, you can have tight muscles there that can present as lateral elbow pain. So a detailed assessment where we look at the head, the neck, the shoulder, the elbow, the forearm, checking the nerve structures, checking that the nerve isn't tight, that it isn't the disc that's referring into that area. So making sure that is in fact elbow and the muscles around that area. Treatment can consist of manual therapy, which involves mobilizing the joints. It can involve some stretching exercises for the nerve. That can make a big difference. We can do massage around the actual elbow area. Dry needling or acupuncture can be effective for tennis elbow. And there's a couple of specific exercises. One that involves eccentric loading, which involves having a light weight, bending the wrist back and up with your palm facing downwards and your forearm flat on work surface, and slowly bring the wrist down and forwards, repeating that several times. This is one of the most effective exercises, so eccentric loading of the actual wrist. The protocol would show that it takes 12 weeks of doing these exercises to make a change to the structure of the tendon, so that long term it's unlikely that you will have a repeat of this. Other options include, injections and surgical management, but as physiotherapists, we would clearly advise you to steer away from them. And the evidence now shows that actually you doing your exercises given to you by the physio is just as effective as these higher end interventions. So, a couple of little tips there on how to manage your wrist and elbow pain. As ever, if you have any questions, give us a shout, and we'll speak to you soon. Bye bye.